you're not able to see a provider, that's not acceptable. So I will just, I'll give you my personal card with my direct number. Call me directly, and I'm going to make sure to connect you to the right person because your child should be able to see your provider.
You know, I call every single department of the state and say, you know, I'm a working mother.
Okay, well, you're going to get the right one here. So it's a good thing you came tonight.
But I just want to let everybody know what's going on,
Well,
because they always ask, you have medical? And why do you have to wait days? Like my child is with a brittle bones. You get a fracture, doing pain, you need to have a cast, you need to see a doctor today, not 3 days.
Well, this is the man you want to know, see? Okay, who else do we have? Chris, hold on to it.
Unfortunately, I was diagnosed with breast cancer, and I was able to see an oncologist and a surgeon. They told me, just pills. If the act stayed in place, if the law stayed in place, I could only get pills because of my age. Because of the $700 billion, I guess, that's getting cut from Medicare. Who am I to believe? I mean, I'm so confused about this.
Okay, well, we can answer that to Medicare, but there's not $700 billion being cut from Medicare. What is being taken from Medicare is that we actually are going after all these frauds, all these doctors who are putting in all this false claims. And so when we're saying we're saving $600 billion over 10 years in Medicare, what we're talking about is that we actually funded investigators and auditors to go after these doctors who have been cheating us. And by the way, Florida and Southern California are #1 and #2 with the number of fraud that's happening in Medicare. And we've already we started a course, this law started 2.5 years ago, so we started into Medicare on this. And so we got the, you know, you're always about a year behind in getting the information about what happened and how it happened, etc. But we got our first report of the first year, and it was like a $60 billion, we stopped $60 billion worth of fraud. And so we're really hitting hard on this whole fraud issue. So when people say, oh, we're cutting all this money out of Medicare, no, they're turning that around. What we're doing is we're going after the doctors who've been cheating us for a while.
So you're saying that those doctors were just lying to me about just getting pills? I mean,
You take that.
There's not anything in the Affordable Care Act that says doctors have to do this or have to do that. I think that in your situation, you know, health plans do take and cover situations where if you are not comfortable and you're not satisfied with your health care plan for your provider, that they will pay for you to go and get a second opinion, things on your care and your situation. That might be an option to check and see if, you know, clinically, you know, who knows. But I mean, the, you know, prescription for the pills and things, there should be justification as to why that is the appropriate course of treatment for you rather than some other course. You know, that pursuing a second opinion might be a reasonable thing to do.
What else have we got?
The question I have for you, the Affordable Act doesn't have coverage for dental because I see a lot of seniors.
Get back that microphone, Chris. You're not doing your job. Okay, no. You can speak into it.
Okay.
Okay, does it have dental? Medi-Cal or Covered California or what?
Or any of them. Do they have any dental coverage? Because I'm finding a lot of people that have existing problems with their teeth that end up getting infected, and they're not being treated by a lot of dentists who does not take Medicaid or Medicare, and that's a major problem because then it creates a lot of disease that could have been taken care of if they would have had dental. And I think people need dental along with that.
I can answer the Medi-Cal question. So Medi-Cal in Orange County in California is not a managed care benefit. It's a fee-for-service benefit. It's under the Denti-Cal program. So for adults currently, it's only an emergency dental benefit. Beginning in May 2014, there was a state budget decision just a couple months ago, that adult dental was restored to its previous level. So adult dental will be a benefit in California through Denti-Cal, not through CalOptimal, but through Denti-Cal. But currently there is coverage for emergency dental conditions.
So for Covered California, pediatric dental care is one of the 10 essential services that needs to be covered in every plan. But what Covered California has decided to do, even though adult dental is not one of the essential services, they have announced some low-cost dental plans that will also be available on Covered California that you can add to your plan. So they're going to do the same thing with dental plans as they did with health plans, so that you can see exactly what you're getting and compare across dental plans, you know, in terms of what they're going to cost and what they're going to cover. That whole process is going to be a lot more transparent, and they've negotiated rates as well.
Okay, by the way, I've been a Congresswoman 17 years. For the first 14 years, we had a health care plan, part of which I paid. We had no vision or dental. Now, so think about it. You think that we have this golden Cadillac, no vision or dental. Starting 3 years ago, we have supplemental plans if we want to pay for it, just like the type of plan you just spoke of, and then we can pick it up if we want and pay for it. But so yes, vision and dental is incredibly important, but even Congress people don't have it. Okay.
Thank you.
Is it true? Okay.
Thank you very much.
Yes, of course. Okay, we have time maybe for one more question, and then I think we're going to break up just because we're going a little bit over time, but there'll be Covered California people in the back who, if you run over to them, might be able to answer something. Okay, one more question.
Does ACA affect Medicare reimbursement?
Does ACA affect Medicare reimbursement?
One of the reasons, we didn't get a chance to talk about this, but one of the reasons why the law has so many pages is because there are so many demonstration programs and pilot programs in there to look at how do we bring the cost of health care down and how do we improve the outcomes from our healthcare services. So one of the things that's happening in Medicare as a demonstration is these accountable care organizations, where they're looking at having more Kaiser-like models within Medicare. And so that is looking at, can we change away from this fee-for-service, which has really ballooned our healthcare costs, because instead of paying people for what, providers for what the patient needs, we've been paying them for how many things they do. So if you have very entrepreneurial providers, they're going to make sure that they do as many things as they can within what they think is responsible practice. So we're working on changing to move away from fee-for-service medicine. But it's only going to be done in a way that improves the quality of care.
Okay, well, we're over, and I'm getting the